My name is Monica Marasco, and today I will be talking about the anatomy of the integumentary system. I have the points that I will be talking about today in this video, starting with the components of the integumentary system, which consists of a cutaneous membrane, which we call the skin, a superficial epidermis, and a deeper dermis. As well as accessory organs and structures, including hair follicles, nails, and exocrine glands. So starting with the superficial epidermis, which is composed of stratified squamous epithelial cells, there are 4 cell types within and around the epidermis. Those are keratinocytes, melanocytes, Merkel cells, and Langerhans cells. The last 3 are scattered among the keratinocytes within the 5 layers that make up the epidermis. There is a thick skin and a thin skin. The thick skin consists of all 5 layers of the epidermis, and that is on the palms of your hand and the soles of your feet, whereas thin skin is skin that isn't the palms of your hand, soles of your feet. It's everywhere else. Those 5 layers, starting from the deeper structures to the most superficial, are the stratum basale, the stratum spinosum, the stratum granulosum, the stratum lucidum, and the stratum corneum. The stratum lucidum is only found in the thick skin. The epidermis also has quite a few roles, but the most, or the ones that I commonly think of when I think of the epidermis, include thermoregulation, via sweating, and protection against pathogens in the environment and water permeability. There are many others, but those are the ones that I think of most commonly. And then deeper than the epidermis is the dermis. The dermis is composed of 2 layers, the first of which is the papillary layer, which is composed of blood vessels, lymphatic components, and sensory receptors. The papillary layer supports and nourishes the overlying epidermis. The deeper of the 2 is the reticular layer. The reticular layer is a meshwork of collagen and elastic fibers that are oriented in many different ways to help resist tension. The reticular layer also attaches the epithelium dermis to the underlying tissues such as muscle. The dermis also aids in thermoregulation and has many sensory receptors. Deeper than the dermis is the hypodermis, or the subcutaneous layer, which is not technically part of the integument, but because it helps stabilize the skin position against the underlying organs, tissue such as muscle, it's included in this section, although it offers limited movements and whatnot. And then for my clinical application as a future nurse, I'm sure I will be dealing with a lot of burn victims. However, the book didn't really go in depth about burns, so I'll decide to talk about helping with wound care with patients who just came out of surgery. I know the book said that surgeons prefer to do incisions parallel to those tension lines in the dermis, but sometimes they can't make that cut. They have to make a perpendicular cut, which doesn't allow the wound to heal as quickly as if you were to cut along those tension lines. It takes a little bit more time and care, I'm sure, and a little bit more attention toward taking care of that wound. So that's the clinical application that I'm sure I will see a lot as a nurse in the future.